What is anthrax and how does it affect animals? Anthrax is a disease caused by the bacterium Bacillus anthracis. It affects both humans and animals and can be deadly if left untreated. Symptoms of anthrax include fever, chills, and muscle aches, followed by vomiting, diarrhea, and abdominal pain. If the disease progresses, it can lead to shock and death. Animals are particularly susceptible to contracting anthrax because they often graze on contaminated grass or drink from contaminated water sources. The bacteria can also enter their system through open wounds or cuts. Once inside the animal's body, the bacteria multiply quickly and release toxins that cause severe inflammation and damage tissues and organs. If untreated, anthrax can be fatal in as little as 48 hours. 3 types of anthrax affect animals: gastrointestinal, skin, and pulmonary. Gastrointestinal anthrax is the most common form of the disease in animals. It occurs when the animal ingests infected food or water. Symptoms include loss of appetite, lethargy, vomiting, hemorrhagic diarrhea, and sudden death. Skin anthrax occurs when the bacteria enter through an open wound or cut on the skin. The infection manifests as a raised lesion that is hot to the touch and filled with pus. Lesions may also develop on mucous membranes such as the nose, mouth, or anus. If left untreated, skin anthrax can lead to sepsis or blood poisoning. Pulmonary anthrax is animals' least common but most dangerous form of the disease. It occurs when the animal inhales infected spores from the environment. Symptoms include fever, difficulty breathing, coughing up blood, and collapse. Pulmonary anthrax is usually fatal within 24 to 36 hours. Early diagnosis and treatment are essential for survival. Anthrax is a serious disease that can be fatal in both humans and animals if left untreated. Animals are especially susceptible to contracting it because they often graze on contaminated grass or drink from contaminated water sources. 3 main types of anthrax affect animals: gastrointestinal, skin, and pulmonary. Early diagnosis and treatment are essential for survival. Veterinary students should be aware of the signs and symptoms of this disease so that they can properly diagnose and treat it in their patients. In the following segment of this presentation, Dr. Kamran Ali Chandio will discuss how this disease affects animals.
Hello everyone, so today our topic is about anthrax disease in animals by Dr. Kamran Ali Chandio. We will discuss on topics: what is anthrax, types of anthrax, causes of anthrax, signs and symptoms, prevention, control, and treatment. What is anthrax? Anthrax is an infectious bacterial disease of animals caused by the spore-forming bacteria Bacillus anthracis. Anthrax is zoonotic disease. Types of anthrax. There are 3 types of anthrax: cutaneous, through the skin; gastrointestinal, intestine; inhalational, lungs. These are the animals which are affected by anthrax. Types of anthrax. Number 1, cutaneous, skin. An uncommon cutaneous skin infection due to bacterium Bacillus that is found in the environment and typically causes illness in animals. Cutaneous skin anthrax is marked by a boil-like lesion that eventually forms an ulcer with a black center. Number 2, gastrointestinal, intestine. The gastrointestinal GI anthrax develops after eating contaminated meat. Inhalational, lungs. Inhalation anthrax develops when animals breathe in anthrax spores. Causes of anthrax. Anthrax is a serious infectious disease caused by gram-positive, rod-shaped bacteria known as Bacillus anthracis. It occurs naturally in soil and commonly affects domestic and wild animals around the world. Signs and symptoms: stagger, have difficulty in breathing, tremble, and finally collapse and die within a few hours. High fever, depression, unconsciousness, lacking awareness, difficulty breathing, seizures, and death. Prevention, control. Annual preventive vaccination. Quarantine animal in outbreak. Don't use contaminated food to feed animals. Treatment for Antibiotics of choice include penicillin and oxytetracycline. For small animals, amoxicillin, deoxycycline, and fluoxetine have been recommended. Thank you for listening and watching us. We will meet again with other important topics.